So you will never become happy from any sort of content of reality. Experiences, relationships, materials, okay? Liberation comes from understanding
I'm kind of ready for this hair transplant to begin already. Hey guys, Dr. Gary here. So today I want to do a reaction video to Connor Murphy's hair transplant without anesthetics. You know, I did a podcast with Joe Tillman, and in that podcast he brought up this guy and how he had a surgery for his hair without any anesthetic, and he actually brought it up in the context of firing one of his clients, which was, I guess, this hair restoration clinic that offered the surgery in the first place. So, you know, he kind of, when Joe first mentioned this to me, he kind of caught me off guard because I'd never had anyone, you know, want to do a hair transplant without any anesthetics. So I was like, I'm not really sure how I would respond to that. I did tell him I had one patient, we did PRP for her scalp to try to, you know, get those growth factors in and do like a medical therapy type of thing, and she didn't want any numbing at all. And so we just went in and got that done, and that was okay. But a hair transplant is different. You're dealing with more bleeding, you're dealing with more potential pain. So, you know, I'm curious to see how this all went.
You think it's gonna hurt?
Yes.
At least he was
I
honest.
just had another hair transplant, and I attempted to do the entire procedure without any medication whatsoever, not even topical anesthetic, which I believe has never been attempted before in the history of hair transplants. So this is a fairly historic video.
Well, I'm not sure if it's never been attempted, but, you know, probably not documented.
How did it go? Well, watch the entire video and find out. So why did I get a hair transplant? Well, over the past couple of years, I've been attempting to regrow my hair naturally. It's actually been going fairly well. Progress has been slow, but it has been progress. But over the 40-day fast, I definitely lost quite a bit of hair due to the lack of nutrients. After the 40-day fast,
Yeah, I mean, significant weight loss can cause hair loss for sure. So I guess that's what he experienced.
I gained some of it back, but I was like, you know, I could use some help, right? And there's definitely some hair around this area, right around the hairline, that simply isn't going to grow back from natural means. It's too
And he's talking about his hair, but he's got the hat on, so it'd be cool if he showed us what he was talking about.
far gone. So I was like, why not get it touched up, right? And I thought I could do this epic YouTube video as well. So first of all, before I get into it, should you get a hair transplant? Well, if you think a hair transplant is going to bring you happiness, if you think a hair transplant is going to fulfill you, if you are getting a hair transplant out of some insecurity, I would dig a little deeper, because you will not find happiness trying to manipulate the external world.
He's getting into some deep conversation here. I think the answer to his first few questions is yes for many people. So let's see what he has to say.
Jesus said, clean the inside of the cup, and then the outside will be clean. You must fix your internal world first before the external world is fixed. Because essentially, the external world is just a manifestation of your internal world. So you will never become happy from any sort of content of reality. Experiences, relationships, materials, okay?
Liberation comes from understanding your true nature, understanding the context of reality.
I'm kind of ready for this hair transplant to begin already.
Realizing that you are infinite consciousness, and that you are simply experiencing this character, but you are not this character. Or you are not only this character, right? Understanding the video game nature of reality. And once you realize that this is just a character, then go for it. Upgrade your character. I mean, your character is here to have fun with.
I do agree that, you know, you need to be sort of fulfilled before doing any kind of cosmetic surgery. You know, not expect that to kind of make you happy, but let's kind of get to the transplant part.
How was I able to even attempt this procedure without any anesthetic whatsoever? Because if you ask any doctor, they're gonna call me absolutely crazy. Like, no, there's no way. You can't handle this pain. These are giant, thick needles poking huge holes in your head, okay? Well, throughout thousands of hours of meditation, I have a different relationship with pain and emotions in general. Okay, see,
I think it's not just your emotional connection to the pain, it's also that some people don't have as many pain fibers and don't sense pain in the same way, and that's been demonstrated throughout many different research studies. So some people just don't have the same, and actually it runs in families. There are genetic conditions where people just don't feel pain. Actually, it's dangerous because you can burn yourself if you leave your hand on a stove, let's say, and it gets really hot, and you know, you don't have any pain, so then you're going to burn your skin off the hand without realizing it.
no experience is inherently negative. And you don't have to see pain as negative. So it's not like I block out the pain, I still fully experience the pain, but I can see it from a more objective viewpoint. There's this concept in Eastern cultures called no self, right? Essentially, the sense of self that you have. You think that you're this entity behind your eyes looking at the world, right? Well, that self doesn't really.
The music in the background is actually quite soothing that he has playing there. But I am really ready to see this transplant. I'm almost like ready to fast forward here, but let's give him a chance.
Exist, okay? It's this complex configuration of thoughts, essentially. And through deep meditation and conscious work, you can realize that this is an illusion and that you're actually the entire field of consciousness, right? And so when you have this experience of no self, you can look at this new perspective and
Are those
realize
like mushrooms in the
these
back?
sensations and these emotions.
It looks like he's got some mushrooms in the background there. Some psychedelics. What is he doing over there?
Pain, right? Let's take pain, for example. It simply arises in consciousness and passes, but it doesn't actually happen to anyone. Okay? Does that make sense? Because your sense of self is really just this culmination
Oh,
of
I think the
thoughts.
hair
And the
transplant
pain
is
isn't happening
coming
to the
very
thoughts,
soon.
right? Let's get into the surgery and see what happened. All right, guys. So I am here with Dr.
Finally.
the best hair transplant doctor in Texas. So we're doing something a little interesting.
So this is Dr. Rocha in Texas. All right, I haven't heard of him, but let's see.
We're doing something a little interesting today. So we're planning on giving me about 2,000 grafts, a little bit on the top and a little bit throughout here. And we're doing.
I mean, 2,000 grafts is not a little bit. I mean, it's a real procedure. There are sometimes more like small, like minor procedures, a couple hundred grafts. When you're talking about 2,000 grafts, that's a real full day surgery. So it's not a little bit here, a little bit there. That's like a real full transplant surgery. And it looks like they're in some sort of a procedure room. The rooms in Manhattan here are typically not as big as what I'm seeing in this room in Texas. I guess, as they say, everything is bigger in Texas, right? So I see 2 overhead lights, and I see Connor's got this neck pillow for comfort. He's in a gown. I see other kind of surgical equipment in the background. So let's see how this goes.
Doing something very interesting. So normally when someone comes in to get a hair transplant procedure, what are the medications that you give them?
So we take the edge off the numbing anesthesia part of the procedure by giving the patients a anxiolytic cocktail.
Okay.
And then we proceed with the smallest needle possible.
So it'd be nice to know which anxiolytic cocktail he gives. I mean, I specifically will give people generally Valium 5 milligrams and Ambien 5 milligrams. So it's both an anxiolytic, and actually Ambien is a sleep medicine. It's a little bit of even a dissociative, but it helps kind of relax people for the procedure as we get started. So I do the same thing before doing the numbing. We give that cocktail in my practice.
To administer the local anesthetic, short and long acting.
And by short and long acting, I think he's referring to lidocaine, which has a quicker onset but doesn't last as long, versus something like bupivacaine or Marcaine, which takes longer for onset, but the duration is longer. So I also use both of those when we're talking about anesthetics for hair transplant and for other surgeries.
To numb the area that we're going to work in.
I got you. So there's some numbing of the scalp, so you don't feel so much pain, and then also I get you take some Valium, right, to knock the edge off as well.
Oh, yes. It is Valium that they give. Good.
The plan is, I'm actually not going to be taking any of those. So have you ever heard of a hair transplant being done without local numbing anesthetic?
No.
I haven't either.
So let's talk about why the local anesthetic is used. The obvious reason is because it helps block the sensation of pain. And so that's the obvious reason. But one thing that is important to remember is that the local anesthetic also has epinephrine in it. Epinephrine is a vasoconstrictive agent. So it basically clamps down on blood vessels and it helps reduce the bleeding in the area. So when you're doing extractions, it's helpful to not have blood everywhere for when you're pulling these hairs out, or else it becomes very difficult to proceed with the surgery. And also, you don't want the person to lose a lot of blood. Same for when you're working on the recipient area. You want the hairs to survive, to properly be placed and not pop out. If there's bleeding going on, it becomes harder to do the surgery. Is it impossible to do without epinephrine? No, it depends on the person. I don't think it's necessarily impossible, but it definitely complicates things and it potentially leads to some unsafe conditions for the patient, but also you risk not having as good of an outcome once the surgery is over.
Do you think it's gonna hurt?
Yes.
I think it's gonna hurt too, but that's the point. I'm gonna find equanimity. I'm going to meditate the whole time and find equanimity regardless of the pain. So we'll
Are
see how
you
it
sure
works.
you want to do this?
You know, I'm sure we're going to try it, and if it's too much pain, of course, we can numb me, right? But we're
Okay.
going to just see how far it can go.
I want you to know that we have plenty of local anesthesia.
Okay, I'll keep that in mind. So we'll see how it goes.
Just
Yeah.
let us know.
All right.
Yeah, so one of the questions that came up during that podcast with Joe Tillman is, should a hair transplant surgeon even offer a hair transplant like this without any local anesthetic? And again, I think you can potentially debate it both ways, but I do agree with Joe, and I agree with Spencer Coburn, who chimed in, that it's really not the proper way to do a hair transplant. And even if the patient asks for it, I agree that it's the right thing to do is just to say no.
No, God! No, God, please, no! No! No!
I wouldn't offer the transplant in this way, even if it meant, putting it up on YouTube and getting more subscribers and that sort of thing. You have to, as a doctor, I believe, sort of do the right thing first and really kind of look out for the patient, even if they don't necessarily always see the risks.
Yeah, guys, so we just got done putting 2,000 holes in my head and then 2,000 hairs in my head. So, yeah, Doc, tell them what happened.
Yeah, well,
They sort of sped through that, so it was hard to tell. They put the whole surgery into like a 3-second kind of clip, and then if I look in the background there, it looks like it's 5:40 on their clock in Texas. I'm assuming that's PM, probably the end of the day. So they didn't really show us all the different steps of the procedure and how it went for them, but I guess they're going to talk about it now.
seeing was believing, but only because, it was occurring right before my eyes. I have never seen someone be able to do half a procedure with no anesthesia.
So it sounds like maybe Connor got through half of the procedure without any anesthesia?
Pain medicine or anything to ease your pain and discomfort. He didn't tap out, but I did because
Right.
I was having a hard time seeing because of.
Yeah, I
So it seems like Connor wanted to keep going and continue to do the transplant without any anesthesia, but then the doctor felt like he wasn't able to see because of the bleeding, so he had to put in the medication.
basically so profusely bleeding, and I probably won't show that on YouTube so they don't restrict the video, but we did about 1,000 grafts, right? So 1,000
Half the
holes,
surgery.
about half the surgery, right? 1,000 holes in my head, and then we had to call it quits just because I was bleeding so much, right? And the topical anesthetic helps with the bleeding a little bit, I suppose, right? So
The topical, the anesthetic, yeah, there's a little bit of a vasoconstrictor
Right.
that decreases the size of the blood vessel.
right. So we didn't want to it was quite the interesting experience, That's the power of meditation, the power of the mind over matter. And
Yeah, I mean, they didn't really show him surviving through the procedure, but I guess the bigger question is, was this really worth it? Is this something that should be offered by hair transplant doctors? Is this going to affect Connor's results? I guess only time will tell, but yeah, I definitely wouldn't offer this in my practice, and I would hope that other hair transplant surgeons are wise enough to kind of, not offer it and to resist the temptation of trying to, get a lot of views online or whatever it might be. Always have to do the right thing for the patient, despite whatever spiritual or other types of thinking they might have that they think they can, kind of impose on the situation. So that's my impression. I hope Connor has a nice result with his hair. I hope the doctor probably won't offer this in the future, is my guess. That's it for the Connor Murphy reaction.